A very good evening to all of you. Today we are going to do the MCQ challenge of pediatrics. Well, pediatrics has a high weightage in the Neet PG and INICT exam, especially the questions on developmental milestones, the infectious disease part, the pediatric oncology part are usually asked. So let us move on to the first question. Which epileptic syndrome is associated with left hemispheric atrophy in a child? A. Dravet syndrome. B. West syndrome. C. Lennox-Gastaut syndrome. And D. Dicke-Davidson-Masons syndrome. Now the question is that which epileptic syndrome is associated with left hemispheric atrophy? Underline this part. Left hemispheric atrophy. Left hemispheric atrophy in a child. So these all four syndromes are epileptic syndromes. But Dyke-Davidson-Mason syndrome, there is hemiatrophy or hypoplasia of unilateral cerebral hemisphere resulting from CNS insult in fetal or early childhood period with a compensatory ipsilateral calvarial hypertrophy. That insult it could be either vascular, it could be either congenital, or it could be acquired ischemic disease. It could be trauma or inflammation. Now coming to in utero gestational vascular occlusion involving middle cerebral vascular territory or coarctation of mid-aortic arch may decrease the carotid arterial flow. So the correct answer here is Dicke-Davidson-Mason syndrome. A 5-year-old boy has recurrent infections, low platelet count, and rash, as shown below. What is the likely diagnosis? A. Severe combined immunodeficiency. B. Job syndrome. C. Bruton's agammaglobulinemia. D. Wiskott-Aldrich syndrome. Here they have given eczematous rash, thrombocytopenia, immunodeficiency, recurrent infections, which is a feature of Wiskott-Aldrich syndrome, which is an X-linked recessive disorder due to mutation in WAS gene mutation on chromosome XP11. So the correct answer here is D. Wiskott-Aldrich syndrome. Which of the following scoring is done to assess respiratory distress in neonates? A. Crib score. B. Abgar score. C. Silverman-Anderson score. D. SNAP score. C. The Crib score. What is Crib score? It is Clinical Risk Index for babies. It is a tool for assessing initial neonatal risk and comparing performance of neonatal intensive care units. Crib score is a validated measure of initial mortality risk and illness severity within 1 hour of admission. It takes into account the birth weight, gestational age, body temperature, and base excess. So the correct answer here is Silverman-Anderson score. Which of the following gene is implicated in pathogenesis of juvenile myoclonic epilepsy? A. FMR1, B. Fibrillin1, C. Chine1, CHYNN1, GABRA1. Juvenile myoclonic epilepsy has been linked to mutation in many genes including CACNB4, CLNC2, EJM2, 3, 4, 5, 6, 7, 9, GABRA1, GABRA-RD, and myoclonin 1 or EFHC1. So the correct answer here is D, GABRA1. True about Fragile X syndrome is a triple nucleotide CAG sequence mutation, 10% female carriers mentally retarded, males have IQ 20 to 40, C gain of function mutation. Triple nucleotide CAG sequence mutation, false CGG repeats are seen in Fragile X syndrome. 10% female carriers mentally retarded. This statement is false because mental impairment with retarded or borderline IQ occurs in 35% of carriers. Males have IQ 20 to 40. Mean IQ is 42 in males. IQ is higher, significant. Gain of function mutation, again, this is false. The abnormal expansion of CGG repeat leads to hypermethylation and consequent silencing of FMR gene. In which of the following disease these X-ray findings are seen? A. Gaucher's disease. B. Fabry disease. C. Markey disease. D. Niemann-Pick disease. It is Markey disease. In which of the following diseases the skin rash shown in the picture is usually seen? A. Multiple carboxylase deficiency. B. Biotinidase deficiency. C. Alkaptonuria. D. Heart nerve disorder. Characteristic skin lesion of neck known as Casal's necklace is seen in pellagra. So the correct answer here is D. Heart nerve disorder. An 8-day-old neonate present with hypoglycemia, but is glucose 17 milligram percent, and jaundice is diagnosed to have metabolic disorder. Most likely diagnosis is A. Hypothyroidism, B. galactosemia, C. Glycogen storage disease, D. Fatty acid oxidation defect. It is hypoglycemia and jaundice in a neonate after initiation of breastfeeding suggests a diagnosis of galactosemia. Please click the link in the description box to join the ultimate 2-day Neet PG breakthrough blueprint. It covers all the 19 subjects in holistically in 2 days. Identify the disease in this child with violet color rashes around eye and on hands. The four options are A. Juvenile dermatomyositis, B. Systemic lupus erythematosus, C. Kawasaki disease, D. Enoch-Shannon purpura. Juvenile dermatomyositis, heliotrope rash on eyelid. The correct answer here is juvenile dermatomyositis. The correct answer is A. Identify the device used in resuscitation: pulse oximeter, NIBP monitor, C. Defibrillator, D. ETCO2. It is a defibrillator. A 2-month-old baby with central cyanosis presented with following findings on chest X-ray and ECG. What is the most probable underlying diagnosis? A. Tetralogy of Fallot, B. Hypoplastic left heart syndrome, C. Coarctation of aorta, and D. Epstein. Here you can see ECG shows tall Himalayan P waves, and chest X-ray shows a box-shaped heart. And this is Epstein's anomaly. So correct answer here is D. Epstein's anomaly. The skin lesions shown in the picture are seen in which heart disease? A. Eisenmenger syndrome, B. Rheumatic heart disease, C. Infective endocarditis, D. Heart failure. It is rheumatic heart disease. The following X-ray picture is seen in which CCHD? A. TGA, B. TA PVC, C. TOF, D. tricuspid. It is TA PVC. Which congenital heart disease is associated with child's condition? Well, the child has micronathia, retronathia, and it is seen in Pierre-Robin syndrome, and which is associated with atrial septal defect. So the correct answer here is A. Atrial septal defect. Lutem-Bacher syndrome comprises of A. Ventricular septal defect with aortic stenosis, ruptured sinus of valsalva aneurysm, C. Atrial septal defect with mitral stenosis, D. Complete common. It is atrial septal defect with mitral stenosis. Which of the following condition can give the figures associated with A. Parvovirus, B. Infection, MDS, C. Down syndrome, D. Fanconi's anemia? A child with short stature, dislocated hip, microcephaly, broad nasal base, epicanthal fold, micronathia. It is seen in Fanconi's anemia. The following X-ray finding in skull can be manifestation of A. AML, B. Hereditary spherocytosis, C. G6P deficiency. The skull is showing uh, crew cut appearance, which is suggestive of expansion of bone marrow and which is seen in thalassemia. So the correct answer here is D. Identify the nature of this finding: A. Renal cell carcinoma, B. Hydatitis, C. Polycystic kidney, D. Medullary sponge kidney. It is polycystic. Maximum urine osmolality in a preterm neonate is A. 200, B. 400, C. 500, D. 800. It is C. 500. What is the most common complication of malaria in children? Severe malaria. Peripheral smear is sickle cell anemia. Poor prognostic indicator of ALL is A. Female sex, B. Leukocyte count less than 50,000 per microliter, age greater than 1 year, D. Hypoplasy. It is hypoplasy.